Nursing as a profession is established on the principles of caring for individuals, meeting basic human needs, and being advocates for the most vulnerable in society. The role of a nurse is to deliver holistic care for patients. This can be guided by the idea of practicing in a patient-centered approach and using the 3 C's to guide all care, being care, compassion, and communication. The role of a nurse has shifted from only providing clinical care and treating diseases and symptoms to now holistically caring for the entirety of a person. Patient-centered care is defined by McCormack and McCants as an approach to practice established through the formation and fostering of healthful relationships between all care providers, service users, and others significant to them in their lives. It is underpinned by values of respect for persons, individual rights to self-determination, mutual respect, and understanding. McCormack and McCants' person-centered framework was established on studying principles of human science and human values. The values recognized from the study which guided the framework were that of holism, human freedom, responsibility, and relationship. These values ensure that those receiving care are maintaining feelings of human dignity and respect, and ensures that patients are treated as a human before they are being seen as a patient. Safe care is established through the development of therapeutic and trusting relationships. Key contributors that influence person-centered care and practice include the macro context, which is the role that society and policy play in care delivery, the care environment, which is the context in which care is delivered and the environment's role in influencing care and outcomes, person-centered care processes, which are the way that care is delivered to a person and their family, person-centered outcomes, which are the fundamental goals that the framework aims to achieve in every care setting. These include good experiences of care, involvement in care, feeling of well-being and the existence of a healthful culture, and finally, the prerequisites, which are attributes that allow nurses to be equipped with the values, attitudes, and mindsets necessary to deliver holistic and therapeutic care. These attributes include being professionally competent, commitment to the job, clarity of beliefs and values, knowing self, and having developed interpersonal skills. Today we'll be focusing on the prerequisite of developed interpersonal skills. Prerequisite of developed interpersonal skills is having the ability to communicate at a variety of levels using verbal and nonverbal communication that relates to others and resolves conflict in a mutually amicable way. This prerequisite is essential for nurses to enhance positive relationships across the healthcare teams and therapeutically by establishing patient-centered care. Communication in nursing is more than an exchange of information. It is the connection between 2 or more people and their involvement with one another, especially regarding the way they behave and perceive one another. It is imperative that nurses know how to interact with patients and colleagues because poor communication can impact the quality of patient care, cause poor outcomes, and affect the experience of patients and families. Understanding one's own beliefs, values, and attitudes, and responding effectively to emotional behaviors during interaction. Effective interpersonal skills and communication is essential for patient satisfaction, compliance, and overall health outcomes. To achieve this, a nurse needs to develop advanced communications to understand and respond appropriately to the patient's desires. This positive rapport can lead to effective patient care and better performance. The main goal of the ANZAT domain is to promote person-centered care and ensure the safety and well-being of all parties. The domain we are focusing on today is therapeutic and professional relationships and the role of nurses in fostering relationships between patients, support systems, and professional teams to deliver desired healthcare outcomes. The domain touches on methods to ensure a strong relationship is built between patients and the professional team whilst ensuring boundaries are maintained. Appropriate greetings and communication methods are considered, and cultural differences are understood in order to build rapport with the patients but also across the healthcare team. Collaboration within healthcare is also a vital section of the ANZAT framework to support an understanding of person-centered care and what this could mean to a variety of individuals. Engaging with other health professionals is vital to the care process as it provides a wider scope of knowledge and promotes physically and culturally safe environments for patients and professionals. Furthermore, it's important to ensure all professionals are actively engaged in the healthcare process. This can be done by participating and consistently engaging with peers, supervisors, support staff, and the patient in order to achieve desired outcomes. Another important aspect of therapeutic relationships is demonstrating respect for the patient and their personal wishes regarding their care. This requires a strong relationship and clear communication with the patient. However, an understanding is not the only aspect covered in the ANSAT domain. It is vital to communicate these wishes and values to the entire care team and advocate for the treatment that best supports these values and beliefs. Developing interpersonal skills and engaging in therapeutic and professional relationships are elements that heavily influence patient-centered care outcomes. Both connect to delivering patient-centered care as they both foster high levels of communication, which enables higher degrees of collaboration. Communication is not simply having a large vocabulary, but having the ability to communicate using non-verbal and verbal communication to express a concern for an individual situation and to find a mutual solution to the problem. Effective communication with the client along with healthcare staff will enable a breakdown of superficial dialogue as it will evoke trust and a deeper level of understanding surrounding the individual's attitudes, values, and beliefs, which result in more active engagement from all parties regarding healthcare strategies, thereby making for a more personalized health plan that suits the individual's lifestyle. This active engagement should not only be isolated between the client and nurse, but also between healthcare workers. Uncoordinated care invites disconnected and inconsistent services, which have shown to negatively influence a client's physical and psychological state as well as safety, thereby affecting patient-centered care outcomes. Above all, patient-centered care is built upon respect, ensuring that the nurse and the healthcare team respects the individual's rights and advocates upon their behalf is a core element within both this domain and that of person-centered care, as it treats the individual as a human being with a range of complexities rather than through the scope of the biomedically dominated lens that sees the clients as the disease itself. The strategy of active listening is a communication technique used to enhance the quality of care provided for patients. Active listening requires one showing genuine care and interest towards the person speaking, consequently encouraging them to share further details about their situation. This process requires the listener to be non-judgmental, provide feedback, show empathy, and providing the person with their full attention, responding to those who are speaking. By implementing the strategy of active listening, the prerequisite of developing interpersonal skills can be enhanced. Due to the fact that active listening links the communicating using effective verbal and nonverbal interactions portion of this prerequisite as it allows for holistic interactions. This technique fosters the person speaking to feel comfortable, supported, and understood, as the patient should be leading the direction of care. Active listening is a vital skill for nurses as it allows them to communicate professionally and rationally with a variety of people. Furthermore, active listening has a positive effect on the care environment, specifically in the departments of effective staff relationships and potential for innovation and risk-taking. This also develops the person-centered processes of engaging authentically, being sympathetically present, and providing holistic care. Consequently, multiple person-centered outcomes can be achieved. These outcomes include ensuring a good care experience, providing an involvement in care, a feeling of well-being, and the existence of a healthful culture, all of which also consequently relate to achieving a high level within the criteria of the ANSAT domain, specifically the ability to engage in therapeutic and professional relationships. This domain of the ANSAT not only requires student nurses to deliver effective communication, but be open recipients of communication to learn and engage with nurses who have far greater experience in not only the clinical aspects of nursing, but with the communication elements. Active listening will ensure that staff and clients feel their opinions are being treated with respect by listening to their views, that the student has an open mindset to learning and making mistakes, and ultimately lead to achieving person-centered outcomes for every individual patient.